Hi there, my name is Alexandra Bryant, and this is my VET 122 video for radiographs of the extremities. We always start by entering the patient info into our X-ray computer database. We just use Antech Imaging Services, which is really easy and straightforward. Charlie was brought in to be seen for limping and not bearing weight on her right front limb. She was favoring her left side. After examining Charlie, Dr. Schur found that her right third digit appeared to be painful and slightly inflamed. A radiograph of Charlie's right carpus was captured in order to properly diagnose the cause of the patient's pain and swelling. Medical conditions that could potentially lead to radiographs of the extremities include fractures, pain, lameness, developmental dysplasia of the bones and joints, and trauma. Even though pain and inflammation was coming from Charlie's right carpus, radiographs of Charlie's left forelimb were also obtained for comparison. When radiographing her extremities, X-rays of the opposite limb are always a valuable reference. So we are going to do a lateral view of the right carpus, a lateral view of the left carpus, a craniocaudal view of the left carpus, and a craniocaudal view of the right carpus. You will see here I accidentally chose two of the oblique views of the carpus. The oblique views are actually the least common views of extremity radiographs that are usually taken. So I had to go back and delete those views. It is extremely important to wear full PPE whenever taking an X-ray, just to ensure that you're really protecting your body against radiation and all its harmful effects. Should always be sure that that includes wearing your dosimeter badge, which actually measures the amount of radiation you are getting. It is also extremely important to not leave it in the X-ray room when you're not taking X-rays. If you do leave it in the X-ray room when you're not actually obtaining X-ray images, then your exposure levels will obviously be incorrect. At Ballston Animal Hospital, we actually do not measure the patient's extremities. We have a hospital exposure technique chart that we refer to based on the patient's weight and the body part that you are going to be X-raying. It saves us a lot of time, and it's really convenient because we don't have to get the patient all worked up trying to measure the body part in which we are going to take radiographs on. We just look at the patient's most current weight, and it'll give you the MAS and KVP. When positioning the distal forelimbs, such as the elbow, the radius, the carpus, the metacarpus, or the digits, the patient is in sternal recumbency. You want to note that the terminology does change at and including the carpus. Thus, in two of the radiographic images captured in my video, the elbow is positioned as craniocaudal and the carpus is referred to as dorsopalmar when Charlie is in sternal recumbency. If a patient was in dorsal recumbency for the contralateral image of the proximal limb, such as the scapula, the shoulder, or the humerus, it's titled as a caudocranial view when the thorax is in a VD position. After obtaining the first image, of course, the computer wanted to freeze on me. So we just had to work with it and keep going. I should also mention that a lot of patients for extremity radiographs have to be sedated because it's so painful for them to be in certain positions that we need to obtain certain extremity radiographs. I was really lucky with this patient, Charlie, because she was super well behaved and she didn't need any sedation. And now that we finally got all of our computer technical difficulties squared away, we are ready to take more radiographic extremity views. The label is placed at the dorsal or cranial aspect of the limb for the lateral views and on the lateral aspect of the limb for any opposite views. When I'm done obtaining all the x-ray views that I need, I always like to give one final check that the image is cropped, edited, and the label markers are in the location that they should be. In the lateral view of the right carpus, in my portfolio image, you'll be able to see the third digit is severely swollen.